Hello everyone, welcome to another episode of Health Tech with Purpose. Today we have Koen Kas joining us on our show. Koen is a healthcare futurist, author, inspiring international keynote speaker, and the founder and CEO of Health Scouts. Join us in this exciting episode where Koen discusses the future of healthcare, emphasizing the importance of combining digital technology with biological data to create personalized health experiences.
Hello, everyone. Welcome to another episode of Health Tech with Purpose podcast. And today's guest is Koen Kas, and Koen has been uh, a thinker, luminary in the health space. Building solutions, strategizing with companies. So we really look forward to this discussion, and welcome Koen to this podcast today. Hi, Koen.
Oh,
How are you?
thank you for having me on the show. I look to the variety of things you've covered, all things super exciting. So I hope we can add something to that with this novel for your audience.
Sure. We do look forward. The feeling is mutual, I would say. So, because of the variety of things you have done as well as a strategist and a thinker. So, Koen, as we start, why not we start with a quick introduction,
Yeah, sure.
if you would like, to the people to set a background into the works you've done, the things that you do, and so.
Yeah, sure. So people call me a healthcare futurist, which is kind of nonsense because I cannot predict the future. But I developed a methodology to create a future from a white page, which we call delight thinking. And delight thinking is building experiences close to magic, but real, which help to deal with change. And that is super important because if you look to healthcare, healthcare is super kind of averse to changing something. Why should they? It takes on average 7 years before innovation lands into a system. And while we're going to talk about technology, for instance, I curate the database with every certified health app on the planet. We quickly learned that you do not change the world with tech. You change the world by providing people, hospitals, doctors, pharma companies, countries, the chance to provide experiences to the customer. And that is what comes back into the discussion today. So I'm called a healthcare futurist, but I'm trained as a biomedic. And I
Okay.
used to see cancer patients. I had the chance to develop a number of insights in cancer, developed a drug to treat brain cancer in children.
Okay.
And my life changed completely when I went to see a very old healthcare system in China, more than 2000 years old, where the doctor got paid as long as people in the village remained healthy. And once you got sick, you no longer had to pay. And since then, that became my obsession, my dream, trying to recreate that Chinese doctor in a
Mhm,
digital version,
mhm.
providing all of us, patients today, citizens tomorrow, an avatar, a digital twin, which is 24/7 with us and
Mhm.
sometimes knocks my shoulder and says, Koen, I know something you didn't know, something super exciting, which allows you to change something in your life which will keep you healthy. And so my dream became trying to contribute to build a world in which we die young, but as late as possible. And so far, I haven't met anyone who's against that vision. So that's me trying to contribute, helping that world creation by providing insights in new technology, emerging tech, bringing these together, making sure that all these tech things do not create data in silos that's
Mhm.
killing us, but trying to show to organizations, which can be tech companies, pharma companies, can be nations, can be hospitals, how combining things which are out there and which are emerging helps them to innovate. And this way, they help to build my dream.
Right. And super important, it is in the world of today that we live because I think we are very much sitting on some of these problems since ages now. Like you mentioned about your medical background. So the good thing is that you've seen it, upfront yourself. But the idea is that health needs to be fixed, and we have been talking about it. I liked one of the quotes that you had mentioned, on your website. I'll just speak it out loud. The digital healthcare revolution was only the beginning. The biological revolution, the AI, and the digital twins will render the healthcare practices from the last decades as
Yes.
archaic as those from the Middle Ages. So,
Yeah.
yeah, you touched upon this, as you were introducing, but if you'd like to expand more on this thought, that you are
No,
free to go.
absolutely. So I think we spent quite some time worldwide to kind of realize that healthcare was late getting digitized. Only the shipyards, I mean, the boat sector is even slower, but healthcare was late, and they're still late. But people have accepted that digital will have a number of big advantages, will delete frictions, will make healthcare less frictionless, less more delightful. But if you look to digital, it's basically a super simple introduction of things we have been doing using Amazon, using Spotify, using Uber, while the biological revolution, which is using digital technology, trying to understand who we really are, only now starts to become feasible, adaptable, and implementable. And let me give you an example. So I think people realize it took something like 10 years, $3 billion to once analyze a human genome once. Now we can do that for less than $600 in 3 hours' time with a small device I keep in my hands, and I can send you home with your genetic profile. And again, the question is not about the technology. The question is about acceptance. What are we going to do with that? And when I got myself sequenced 10 years ago, I started to realize that knowing what I'm predisposed to, for instance, I'm predisposed to get blind, that knowing this gives me superpowers. Because since I realized that, I've changed something in my lifestyle, in my diet, and I started to use the second software as a medical device, an SAMD, an AI tool which ever entered the market, to scan the back of my eye with a digital tool so that I can follow how my eye progresses. And if something goes off track, there is still time to interfere and to restore. If I would not have known my genetic profile, I would end up blind at some point in time without any chance to change. That is such an important, really life-changing moment, which I think we haven't met yet with digital. That's showing people the power of what is hidden in their genome to tell what might happen in the future, and using digital to make that insight actionable, that I believe that will have way more impact on our human life than the introduction of digital. Because that also brings with it not just questions about privacy. What if my data go to my insurer, which is a non-issue, by the way, let me explain in a second. But we also will have to ask questions about ethics and morality. Can I still get sick? Is it okay that I still have a handicapped child? Just for you to know, in Hong Kong and Dubai, from next year on, a child will be born with a genetic passport. So the child will get insights which we could have provided already for years in other countries, which we don't do, but which, in my opinion, is so powerful, is so insightful, that this is a fundamental right to have, be to live as long as possible in a healthy fashion. And so, because biology brings questions on ethics, morality, beyond privacy, that's why I'm mentioning that we are still in the middle ages of what is feasible. You might also recall that moment a few years ago at a global soccer championship where a Danish soccer player fell down because he had a sudden cardiac arrest. His heart stopped beating.
Mm.
It's absolutely crazy that it still happens because we could predict these things and we could use digital health tools, apps, to follow in the life of such person who is predisposed to find out how the heart behaves. So using biology to find out what I'm predisposed to and adding a digital layer to, well, to make that insight actionable, that's what I think is going to happen big time. And that is why, in order to combine, well, the data you get out of my genetic profile, the data you need or get out of my microbiome, the microbiome are the bacteria which live in my guts, on my skin, in my eyes, in my vagina, whatever. These are hardly understood, but contain so much relevant insights. For instance, Parkinson's disease is a gut disease that we will not and never be able to understand these insights if something we now call AI wouldn't have appeared on the scene. And while a lot of people link AI with things like ChatGPT of DALI, I believe the real power of AI will be that it will be able to anticipate things from happening. It will be anticipation intelligence. And we will need it as human beings to understand, based on the increasing amount of genetic, biological, protein, RNA data coming out there, and it's called omics, that all these data together will be the input for what at some point in time will become our digital twin. And so one of the big projects we're involved in is a European project where we try to think on what data I could combine with a wearable, for instance, with a super simple Apple smartwatch or with an Aura ring or with a Fitbit, to add a layer of biology so that the insights coming from a super basic wearable, which people have accepted to use and which provides some lifestyle insights, that by showing how biology combined with the digital measure makes you a richer person, gives you more insight in who you are, and gives you the chance to play with your lifestyle in an experienced fashion, so that all of a sudden, by combining biology with digital tools, we will be able to become richer, having way more chance to remain healthy longer, and not having to nag people not to do this, not to do that, but knowing things in advance and to play with that knowledge. And that's why I think that only now, with AI becoming, well, destigmatized and demystified, that's one of the big tasks we have ahead of us, is to show people the art of the possible and to show people who are okay with using digital tools that the real power is adding insights from themselves, which come from their biological profile. And that is where we are now in history. We're going to see that these things will be accepted, will be ready to be used, and they will really open up insights in who we are.
Okay. So, like a follow-up question to this, Koen, if let's say, if this future is, let's say, on a scale of 1 to 100, so this is like the perfect situation of say 100, where exactly we are currently, like how difficult is that journey, or how do you rate our current progress in regard to
Oh,
reach to that
that
100?
we are in, yeah, that's a good question. I think we are at 2 or 3. I give a lot
Okay.
of keynotes, right? And
That's a heartbreak.
if I ask during a keynote, let's say 200 people, who has access to his or her genome, the answer is almost always zero. Whether it's young people, it's old people. Then I provide a number of examples of what is feasible. And then you start to see that by providing people insights in things they didn't realize they could get, the world changes. Let me give you 2 examples, if I may. I can predict the chance that you get colon cancer, 12% chance based on genetics. But if I tell that to people, men say, well, I don't want to know, because afterwards you're going to put a tube in the back of my body, an endoscope. I'm not looking forward to that. But then if I show a very small, tiny pill which contains a 360-degree camera, which I swallow, which makes better pictures than I've ever seen before, all of a sudden, 1 in 5 men saying, I want to know, turns into 3 in 5. So by not knowing that I could swallow a pill to look to my guts, I introduced technology to change people behavior. And that is what I basically do for a living. I show on stage, in showcases, novel technology which is out there, which very often people didn't realize they could get. And that helps them to say, well, now I'm going to do something different with my life. By the way, in the US, I can buy such pill at Amazon. Just like I buy a book or a CD, I buy a pill sent to my home, is recovered out of my body, the data go into my medical records, and my doctor knows more. One example. Second example, it's work in progress, but you might recall Angelina Jolie, who kind of
Yeah.
did a double mastectomy, removed her to breast remove because she was predisposed to get breast or ovarian cancer. She lost her mom to ovarian cancer. If I tell that to my students, they say, well, we are not able to make such a decision. We're 22, we're 23, way too hard. We better not know. Till I show things are in development, textile, brass, which contain at the inside of the cup a very tiny sensor, which sticks to to Angelina's breast and measures the heat when a tumor would start to grow. And only when a tumor starts to grow, my gynecologist says, well, Angelina, now we have to discuss and decide what to do. So imagine nothing happens. I still have my 2 breasts. If something happens, I might already have reached my 55th anniversary. Kids are out of the house and the decision becomes a little bit easier. If I tell that to people, all of a sudden, the perception goes from I don't want to know to bring it on. Because technology changes behavior, and technology is the layer we're going to use in between predisposition, something I'm born with, and execution towards a better, healthier life.
Mm.
Do I make myself clear?
Right. No, that's good to know. So that's the difference. More about than you would say is it's educating and
Yeah,
making it a reasonable choice or making it
yeah.
an
That's
option that is not so hard to take,
yeah,
basically, especially
yeah,
with
absolutely. And for
people
that reason, one of the
looking for
biggest
comfort, basically, making it
yeah,
comfortable.
absolutely. That's exactly it. And I think one of the biggest tasks we have in healthcare, not just in digital health, but also in this entire biological revolution, is creating awareness and educating people. That's the biggest slack we have. And for that reason, all across the world, we really have to make sure that our next generation of care providers, our next generation of doctors, our next generation of scientists, that's fine, but doctors are simply aware of what is coming next and what is out there. And incidentally, at the university I work in Belgium, in Ghent, I have the mandate to introduce digital technology in the faculty of medicine. And you might say, well, why should you? That's simply because everywhere on the planet, that once I get out of school, I don't have time to keep up to date with novel tech.
Right.
And
Yeah.
that is also why our team, we are called Health Scouts, why we curate a database with every certified health app on the planet. And that's not a big database. If you look to the Google stores or the Apple stores, and you would type in health and wellness and fitness, you find more than 130,000 apps. But do you have any idea how many apps are really FDA or CE2 marked certified across the world? It's a little more than 300. That's not a lot. But at least these apps are relevant for doctors, for patients, for citizens to be aware that they're out there. And what we try to do is watch this space. We update a database on a regular basis, and that gives us a pretty good insight in what is needed, what is missing. And that's also how we can help people which start to think about new apps with a number of rules and numbers of advice we try to give to think of in the beginning, not when the app is ready. When then very often it's too late. And I think that is how we met. That is one of the things I talked about at HIMSS in Rome 2 months ago, where I had the chance to be on stage at the welcome ceremony together with one of the famous Italian cooks, Ruben Bondi. And what we did is we made the parallel between making a new dish and making a new app. And I think that's where one of the links to be here on Mindbrowser came from.
Mhm. This episode of Health Tech with Purpose podcast is brought to you by Mindbrowser, a product engineering and digital transformation company focused on health. At Mindbrowser, we enable health companies to build the future of health where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to Health Tech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
Right, right. No, very well articulated. And cost-wise, what are we looking at? Like this precision of care and this comfort of care. Are we also looking at escalation of cost, or do you think that technology, would be able to follow, a cycle where, building all of this comes down so that it is more accessible, rather
Yeah,
than for the next 10 years, it just remains in the
yeah,
hands of
yeah.
top 1%.
Yeah, I think if we would not move into this new digital biology world, then we're going to see an escalation of costs. So I think we are obliged starting to think differently. Yes, we still have sick care. We wait till we get sick and we try to kind of restore things. Look to someone with diabetes.
Mhm.
He or she gets blind, loses kidney function. Kidney patient, one of the most expensive ones in the clinic, and that's why the healthcare system all across the world is basically trying to survive and is reaching, well, red numbers. So the only solution we have is being able there in time to predict and prevent things from striking. By the way, for every 100 euro, dollar, or yen we give to sick care, only 2 euro, yen, or dollar go to prevention, which is
Mhm.
absolutely crazy. If we increase that with 100% and we just take 5% from the curative kind of care, then already we will have and see a big change. So if you could spend the money you have to use to treat a patient with diabetes, to find out using digital tools that I become diabetic, then that's money well spent. So let me give you two examples how I think we will be able to do that. During this talk, you could ask me, well, Koen, can I take a video selfie from you? And we have digital tools now which look to the blood vessels in my face and use an AI algorithm to convert the bloods flowing through my face, which I cannot see, but the app does, into my heart rate and my blood pressure. We know that already a while.
Yeah.
Companies like Neurologic do that. Companies like FaceHeart do that. But now research is ongoing showing that someone who becomes diabetic, who has too much sugar in the blood, makes that the blood gets more viscous. The heart needs to beat hard to get the blood around. And that makes that the bloodstream in my face is a little bit different. So a video selfie could predict someone who's developing diabetes. So imagine your next Zoom call or your next Teams call asking, Koen, can I screen you to predict and eventually prevent that you get diabetes? That is what is going to happen. That costs money, sure, but that costs way less than waiting till I get sick. One example. Second example, fascinating. One of the biggest medtech companies, Medtronic, has acquired a small company called Clue. And Clue has developed an algorithm which uses the movement of my wrist and the movement of my watch to find out what I'm drinking. So by just measuring how I move my wrist, they find out that this is a soda, this is a coffee, this is a tea, this is a glass of wine. And by using that data point, that insight, they will be able to tell me, oh, Koen, maybe instead of drinking that Coke, aren't you up for a glass of water? Because if you don't drink the Coke, that stops the diabetes from developing. So all of a sudden, we're going to use digital tools to enter 24/7 in the life of a patient, the life of a citizen, and we'll be able to provide completely novel experiences, not nagging you, not preventing you, but helping you to change something to the better. And so this way, I think that the cost of introducing such tools into healthcare systems is really minimal compared with the savings we're going to make by no longer getting diabetes in the first place. So we're going to see that we're going to even pay people to use apps for that. In my country, a number of apps which do preventive measurements are being reimbursed by private insurers. Not only here in Belgium, we see that already in South Africa, we see that in a number of US-based healthcare systems. We see things happening in the Middle East, where basically a country like Singapore, really interesting example, I believe, is paying me $2 every day for every day I can prove having lived healthy using a watch and an app, because the country realizes it's less expensive to pay me for that measurement and that data analysis than waiting till I get sick, right? So I think, to come back to your question, in order to kill the cost explosion, I think we will need the introduction of new digital predictive healthcare tools. And then maybe one last thing, and I think that in cancer research, this will have a profound impact. We will be able, and that comes back to the biological revolution, just like we do a NIP test in pregnant women, which predicts that the baby might be a Down baby, a trisomy 21 baby, which implies that I interrupted the pregnancy. The same principle of tests is now applicable to start to look to sporadic cancers, not to genetic hereditary cancers, but to, it's always genetic, but to sporadic cancers as well, by simply looking in one drop of blood. And yes, healthcare systems are afraid that that will make things way too costly, that we're going to screen way too much. But just like we got the air belt, the safety belt and the airbag in a car, right? And I think we're going to do the same with these tests. We're going to make sure that the number of false positives, the number of false negatives, which leads to too much or too little screening, will get out of the system, and that we will have reliable tools to do predictive care. And with the reliable tools, again, the cost of waiting till people get sick will be really diminished. And this way, we're gonna make sure that paying to stay healthy will be a cost benefit and not a cost center. And that's a really important thing. I think we're gonna move to a world where, if not my doctor, I get paid for every day I remain healthy. And that's a mind-changing idea, but that's why we need that delight thinking, which I mentioned in the beginning, to show people how to adopt that thinking and how they can see that they can become part of that world. Mm-hmm. And if I may give one more example, then we got involved in a new clinic which plans to be built somewhere in 2032 in Holland, in the Netherlands. Okay. And conceptually, you could argue every clinic to be built is a failure of the system. because a clinic is looking for patients, right? Till I showed the team over there that imagine that the clinic is not just working for patients, but the clinic starts to become a service for citizens and learns them how to deal with health, provides them early diagnostic tools within the clinic to get screened using digital tools, to find out whether they're predisposed to disease, to look to gait to find out that I'm predisposed to multiple sclerosis, to listen to my voice to identify Parkinson's disease 3 years before you see my tremor, because I start to pronounce my vowels differently, and you can measure that with digital tool. And all of a sudden, the business model of a clinic of the future is no longer treating sick people, but treating healthy people to remain healthy as long as possible. And I think that in the 13 years that I do what I do now, I've seen disbelief and zero interest to enough examples all across the planet of organizations which are embracing that idea. And I think that we really are able to go back to that model where we get paid to remain healthy and to live the healthiest, most purposeful life as long as possible.
Right. Right. No, definitely. I think that is, in summary, the future of care. No doubt about it. So, are there any downsides in terms of adopting this model of care? While all seems rosy, does it also mean maybe like any negative impact or any risk that you see with these models? Like, what are the inherent risks, if any?
Yeah, the biggest challenge, of course, is people have to change behavior in a sense. Eh? A lot of elderly doctors, they use paper and a pen. They use a fax machine. If you look to the biggest customer for fax machines, it's still the NHS. I mean, the fax machine will still work tomorrow. The internet might go down. And that kind of thinking, we've seen it happen the last few weeks, incidentally. So there is fear for digital. There is the idea that digital things will require way more effort from doctors. For instance, if you look to a country like Germany, really interesting, they were the first to have a pretty large apps being launched, which got reimbursed under something called the DIGA system. But after 1 year, only 2% of doctors adopted these apps. First of all, because there was a lack of awareness, was one issue, but also because they had more efforts when they prescribed an app, because they had to collect the real world evidence that the app improved my health. And so they said, well, we are already too busy. We don't have time to do these things. And that, of course, requires that a number of these things will be automated in the future, and that we will be able to collect data from a given app. For instance, an app which treats back pain, or an app which prevents freezing while I'm walking, or an app which collects my heart rate variation to predict something like atrial fibrillation. Therefore, I think we have to make sure that all these apps do not end up with collecting data in silos, but that all these silos at some point in time will need to get connected on one backbone, on one platform. And that's where I see the biggest promise of digital health going. That is to help people not think into their silo, but ask them, well, what happens before I use your digital application? What happens after someone has used your digital application? And how can I stitch the three together? And that is how you build a frictionless healthcare system. Because before I use your tool, something has happened with me. Someone has measured something which you use again, which is kind of crazy that I have to type in again what my BMI is and what my age is and what my historical background is. So how can we start to think about collecting these on one centralized platform? And that is why I think one of the exciting things happening amongst other places, but in Europe, is the fact that we have launched something called the European Health Data Space, which is still an empty box, but which is based on the thinking that we're going to provide ways to decentralize data, no longer collecting all data, sending them to Google or to Facebook or to the government, but providing citizens the ability to collect their data from apps, from their genetic profile, from their lifestyle, from their social determinants of health, into something we're going to call online data stores. And there is something which I think still might fail, but I think it's going to fly. And that is a new version of the internet, which has been built by the gentleman who came up with the first version of the internet. His name is Tim Berners-Lee. He's still at MIT in the US. So he came up with the W3, with the web. But he started to think about, well, is this now it, or can we do better? And he came up with a new protocol called SOLID, SOLID. And SOLID provides the user to get a personal online data store where you decide what goes in and you decide who sees these data. And incidentally, my country, Belgium, has decided to adopt that model and is preparing to launch a citizen-centric healthcare platform, data platform, where citizens will get the chance to put really private data in such a store. So for instance, I could store in that pot that I'm predisposed to get blind. And I add the genetic profile which proves that. And I make it open for every pharma company which comes with a solution. And so they can use my data, maybe in exchange for a reward or from money. That's an option. That's secure. But let me give you two other examples. Imagine I store in that pot that I'm allergic to gluten. What I now have to do, I have to go to my retailer, put on my glasses, and I have to watch on every product I buy whether there is no gluten in it. In the future I'm describing here, I will provide my retailer access to my online data store. And from tomorrow on, there is 25 products I can no longer buy at my retailer because they basically block the fact that I can buy something with gluten. Think about that. I have exchanged one data point, which is not in my medical record, maybe it is, but which my retailer has no access to. That is what we're going to try to build. A system where all the data who define who I am are linked to services I can get, which delight me because they get frictions out of the way, and all these data together, all of a sudden, provide me the chance to get and to build my own personal digital twin. And the more I share, the more I tell to this pot what I dream of, what my big life dreams are, what my purpose could be, I can start to use AI to mine these data and to find out that Koen's big dream might be to climb the Kilimanjaro with my grandchildren, but realizing that Koen has no grandchildren yet. So in order to reach my dream, you have to keep me healthy. And in order to do that, I'm willing to share data, combine that with technology and with art as well, different topic, to really unleash my full potential to make sure that at the end of my life, if you ask me, well, did you live a fulfilling life? I can say yes, because the longer I stayed healthy, the longer I could leave legacy. And the longer I stayed healthy, the more chance I had to experience things, which is exactly what most people have missed when they are asked at the end, well, what would you have done differently? Most people are happy with what they did, but the majority of people is unhappy with the things they didn't experience. And I think that would be a pretty good circle back to your first question. That is why I believe the combination of biology with digital combined and make that mineable with AI will provide us, for the first time, the best chance to find out who we really are, who we really could become. And so that will give us the chance to help people, not just to stay healthy as long as possible, cool, but not sexy, but that will give us, for the first time, the chance to make people really epic. And that is, I think, the highest you can give people. Finding out what really sits in them, using technology in the back to provide them the chance to stay healthy as long as possible, and give them the feeling that they reached their life dreams and unleashed their potential to the max. And that's what I hope to contribute a little bit with this podcast as well.
Mm, right. Thank you so much, Poon. That's really noble thoughts, and hopefully they all land in the right places. That's what we hope as well. So, last question. I would like you to summarize a bit on your work on Health Scout. So, you talked about this database where you have been,
Yeah,
compiling all the digital health organizations. So, tell us, like, what is the purpose of it, what is the methodology around it, and
yeah,
what purpose it serves basically in the uh, scheme of things that you are building.
yeah,
So tell us
yeah.
more about
No, thanks for asking. So I published the first book in 2014, which was called Seek No More. And that's when I started to talk about digital tools, apps out there. And after these keynotes, people said, well, nice, but where do we find the list of these apps? Where can we look at it and find out what we can use ourselves? And to my surprise, we didn't find that list, was not present at the FDA, was not present at EMEA in Europe, was not present. And so we created the first database in 2017, which contained at that time 110 apps, I think. And we keep that up to date. And today, we are 7 years later, we have something like 340 apps. So on average, every 2 weeks, every 10 days, something novel appears in the database. And we make that database free so that people know what is out there. But by looking to these apps, we came to kind of a way to classify them. We look to, is there certification? Are there clinical data? Are there publications? Is there IP? Are there collaborations with pharma companies or with tech companies, or is there adoption? How do apps access the market? And that gave us a way to provide some learnings to novel app developers. And I'll make a short summary in a second. But since we kind of became the gardeners of that database, roughly every week, someone from across the world comes to us and says, well, is what I'm planning to do worthwhile? Is it already existing? How should I develop? Should I get regulation? And sometimes, and this sounds counterintuitive, sometimes we advise not to regulate things. It takes time, money, effort, and sometimes better to prove that your end user is willing to use your app or your tool. And sometimes kind of market acceptance helps to generate so many exciting data that with the data, you can go to a financial partner or a customer so that the end user is not paying, but your customer shown that the app is being used by the end user is helpful, and you find your customer doing that, and then you regulate. Yeah? A fantastic example is an app developed by a company to measure or to find out why my headache, my migraine, where it comes from. And so instead of getting regulated first, they collected so many exciting data that with this data, they went to a pharma company, it was Novartis, and Novartis used that app and these data to help develop a new drug to treat migraine. So that's kind of the insights we gained. And I think I can summarize them in 5 things. Technology, I often believe, but I always urge app developers to spend time in thinking about how will they market the thing. So what will be the way to make sure your end user is going to use it? Do that on day one. Make me the press release of what you will release, because the technology by itself will not change things. So make sure that you start with marketing, if you like. Two, what we often see is that techno people come with a fantastic idea. And yes, they have checked it with one doctor, they have experienced some friction in their life, but still it's top-down development. So they work on developing the app, and then they go to the clinic, they go to a healthcare system, they go to a pharma company. And very often that ends nowhere, because the end user feels not to have been involved bottom up. So instead of thinking top down, think bottom up. For that matter, a fantastic platform built in digital is what Mayo Clinic did in the US. They have reached or built the Mayo Digital Health Platform. And what they do, they make the healthcare data from their patients anonymized, open, accessible for third-party providers, for app developers, for instance, for VCs. And when an app developer lands on the platform, they can use data from the clinic, generated by the clinic, trusted by the doctor. The doctor sees what is being developed, is involved from day one, and feels that he's part of the solution, right? So it's bottom-up development. Advice number 2. 3, if you think about apps, how will they be used? If I look to, I think I have 250 apps on my smartphone, which is nonsense, but because I test a lot of things. But I only use 3 apps recurrently, and they are on my first screen. Waze is one, Spotify is the second. Spotify, by the way, is one of the 3, I think, only good digital tools ever developed in Europe. So how do you make sure that your app sits on page 1 of your smartphone, but also is not leading to negative reactions? Let me give you an example. A few years ago, we did a big hackathon, an event where we brought patients with epilepsy together with app developers, with marketeers, with doctors, with a pharma company even. And we learned very quickly that if an app developer says, well, we're going to make something epilepsy fighter, that the patient said, well, I don't want an app which says epilepsy fighter. Because if the app is on my first page and someone sees epilepsy fighter, he says, well, oh, are you an epilepsy patient? That's stigmatizing. So by just
Small
having
things that make a difference.
by just talking to the patient, the end user, you develop something which appears right. That's rule number 3. Rule number 4, make sure that I can connect, I mentioned that before, that I can connect the data which are collected in my digital tool app with something happening before or after, so that I become stitched into a pipeline, stitched into a continuum. Don't get myself another silo. In the future, I will not be interested in things which are silos, right? That's rule number 4. And then lastly, and it all is kind of, basics, but if you combine the 5 basics into your thinking, I think you make the difference. That is, think about how to integrate in a care system. So make sure that you think upfront across your marketing thinking how it has to land. And people say, well, we have to land into the healthcare system of the US, or we have to land into the care system of Clinic X. But that's not true. A system is a bunch of people. So try to define me at the end who you will have to talk to. Who are the 3 people you have to talk to if you want adoption in a pharma benefits organization in the US? Who are the 3 people you have to talk to if you want to end in a clinic in Mumbai? And so instead of saying, well, we have to beat the system, you can never beat the system, try to find out day one who you will market your product to. So think marketing instead of technology, develop bottom up, think about the app appearance, avoid a data silo, and make sure it lands into a bunch of people which represent a system, These are the 5 rules which we learned, well, by doing and classifying things for 7 years now and having the overview of all things which are emerging under the radar. And I hope that is helpful for your audience as well.
Mhm. Right, right. No, true that. Of course, information is the first thing to start with. Like if you don't have information, then you cannot really, work on that information to be able to build further on that information.
Yeah.
Yeah, good to know, I think, and very comprehensively explained, I must say, Poon. I think I really enjoyed the conversation. Thank you so much, and we look forward to one wishing you with your new book that is coming along. Huge success wishes for that, and also the kind of changes that you are trying to build and trying to bring into the world. Thank you so much.
No, thank you for having me. Look forward to the responses and look forward to see these being published and being out there in the public domain. Thank you so much.
Thank you for joining us on the Health Tech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.